Good morning, dear students. Today we are going to discuss about pancreas. Pancreas means all flesh. Pan means all. Creas means flesh. So we shall discuss the anatomy of pancreas today. The word pancreas, it is derived from a Greek, which means all flesh. It is a large gland present in close to the duodenum and the stomach. Okay, it is present close to the duodenum and the stomach. It is soft and it is lobulated and it has both the endocrine and exocrine function. It is a mixed gland containing both the exocrine and endocrine portions. So this gland, it extends from duodenum up to the spleen. Introduction to the pancreas, it is soft, lobulated, elongated gland with both exocrine and endocrine functions. Exocrine function secretes pancreatic juice, endocrine function secretes insulin and glucagon. Let us talk about the development of the pancreas. The pancreas develops in two parts, both of which arise from the endoderm of the primitive duodenum. The dorsal bud is the first to appear as a diverticulum from the dorsal wall of the duodenum. This eventually forms whole of the neck, body and tail of the pancreas together with part of the head. So dorsal pancreatic bud, it forms whole of the neck, body and tail of the gland together with the part of the head. The ventral bud develops more caudally as a diverticulum. Between the 4th and 8th week, the ventral bud rotates posteriorly in a clockwise fashion to fuse with the dorsal bud. The dorsal duct, the duct of Santorini, opens into the duodenum proximal to the major papilla, that is ampulla of Vater, at the minor papilla, whereas the ventral duct, the duct of Wilson, which is joined with the lower common bile duct, opens into the major duodenal papilla. So we can see here, this is dorsal pancreatic bud, ventral pancreatic bud, and we can see here the fusion of dorsal and ventral pancreatic buds and the formation of the accessory pancreatic duct, which is known as the duct of Santorini, and main pancreatic duct, which is known as the duct of Wilson. Location, it lies obliquely on the posterior abdominal wall, partly to the right of the median plane and partly to the left. And it lies behind the peritoneum, opposite L1, first lumbar and second lumbar vertebrae, or L1, L2, L3 vertebrae. And it lies partly in the loop of the duodenum and also behind the stomach. It lies in the epigastric and left hypochondric regions. Okay, so it is retroperitoneal except the tail, which lies in the lenorenal ligament. The tail of the pancreas lies in the lenorenal ligament. Coming to the measurements of the pancreas, length is 15 to 20 centimeters, or you can say up to 15 centimeters. Breadth is 3 to 4 centimeters, or 2.5 to 3.8 centimeters. Weight about 80 to 90 grams. Thickness about 1.2 to 1.8 centimeters. So the shape of the pancreas is, it is J-shaped, or you can say it is roughly hammer shaped with discoid head and elongated and tapering body with a constriction between these parts of the neck. So we can see the parts of the pancreas: head, then we have the neck, body, tail, and uncinate process. Head is the enlarged right end of the pancreas, a projection arising from the lower left part of the head. It is known as the uncinate process of the pancreas. The head with uncinate process is confined with the curve of the duodenum. Okay, is confined to the curve of the duodenum. Neck, it is a constricted part at the junction between head and the body. So it lies in front of the portal way. Body is a major part that extends from aorta to the left kidney. Tail part extending between the two layers of lino-renal ligament up to the spleen. So the head, it lies within the C-shaped concavity of the duodenum. Neck is placed behind the pylorus, and the body of the pancreas lies behind the body of the stomach. So this is about the parts of the pancreas from right to left. Head is enlarged part, C-shaped, lying within the concavity of the duodenum, consists of three borders: upper border or superior border, then lower and right lateral border. Two surfaces, anterior surface and posterior surface. One process, that is uncinate process, which is in pink in color. So this head, it is situated within the C-shaped concavity of the duodenum. And this head, it lies at the level of L1 and L2 vertebrae in the posterior abdominal wall. So then we shall move the relations of the head of the pancreas. Superior border, it is overlapped by first part of duodenum and superior pancreatico-duodenal artery. So we can see here, this is superior pancreatico-duodenal artery. So superior border is related to, it is overlapped by the first part of the duodenum, as we can see in this picture. It is overlapped by the first part of the duodenum, also related to the superior pancreatico-duodenal artery. Inferior border, it is related to the third part of the duodenum. Inferior border, this is the inferior border. It is related to the third part of the duodenum and inferior pancreatico-duodenal artery. Inferior pancreatico-duodenal artery. Then we have right lateral border. It is related to the second part of the duodenum and terminal part of the bile duct. So anastomosis between the superior and inferior pancreatico-duodenal artery. So it is related to the second part of the duodenum, the right lateral border, and the common bile duct, and the anastomosis between the superior and inferior pancreatico-duodenal arteries. So that is about the border, superior border inferior border and right lateral border relations. Coming to the relations of the anterior surface of the head of the pancreas. So, anterior surface is directed forwards and laterally. From above downwards, the head is related to first part of the duodenum, then transverse colon, and coils of jejunum below the transverse colon. Okay, so these are the relations of anterior surface of the head of the pancreas. So the relations of the posterior surface. Posterior surface, it is non-peritoneal, it is directed backwards and medially. So posterior surface of the head of the pancreas is related to inferior vena cava. Terminal parts of the renal veins and right crus of the diaphragm and the bile duct. So inferior vena cava, right renal veins, or right crus of the diaphragm, bile duct are the relations of the posterior surface of the head of the pancreas. Uncinate process, it is a hook-shaped projection or the triangular projection which arises from the lower and left part of the body. From the head. Arises from lower and left part of the head, not body. It passes upwards and medially behind the superior mesenteric vessels. Okay. Relations of the uncinate process. In front, it is related to superior mesenteric vessels. You can see here. Posteriorly, it is related to abdominal aorta, and above it is related to left renal vein. So those are the relations of uncinate process. Coming to the neck of the pancreas. Neck, it is slightly constricted part of the pancreas between the head and body. Length is 2 centimeters. It is directed forwards, upwards, and to the left. It consists of the neck of the pancreas consists of two surfaces, anterior surface, again you see anteriorly, and posterior surface, two borders, upper border and lower border. So let us discuss the relations of the neck. The anterior surface, it is related or it is covered with peritoneum of the lesser sac, and it is related to the pyloric end of the stomach. The neck of the pancreas anterior surface is related to the peritoneum covering the lesser sac and pylorus of the pyloric end of the stomach. Posterior surface of the neck of the pancreas, it is non-peritoneal. It presents a shallow groove which comprises of superior mesenteric vein. So you can see here, this is a superior mesenteric vein, posterior aspect. Superior mesenteric vein. So it presents a shallow groove, posterior part of the neck, which comprises of superior mesenteric vein in the lower part and trunk of the portal vein. You can see here, this is in the upper part. In the lower part, you have superior mesenteric vein, and upper part, trunk of the portal vein. Borders, we have superior border and inferior border. The superior border is overlapped by first part of the duodenum. Inferior border gives attachment to the root of the transverse mesocolon. Coming to the body of the pancreas. It is elongated part, extends from neck to the tail. And it passes from aorta to front of the left kidney into the transpyloric plane corresponding to the L1 vertebra. It consists of three surfaces. Body consists of three surfaces: anterior, posterior, and one more inferior surface. You have three borders: anterior border, superior border, and inferior border. Because it is triangular in cross section, the body of the pancreas, it has anterior border, superior, and inferior border. Anterior, superior, inferior. Tuberomental is a small projection of the superior border, little to the left of the neck. Relations of the body of the pancreas: anterior surface. We shall see borders first. I told you that body of the pancreas has three borders: anterior, superior, inferior. Anterior border provides attachment to the transverse mesocolon. Superior border, which is close to the right end, and it presents a conical projection known as the tuberomental. It's not labeled here, but approximately it will be here, tuberomental. And celiac artery is related to the superior border. Hepatic artery and splenic artery also related to the superior border. Celiac trunk, hepatic artery, and splenic artery. Inferior border is related to the superior mesenteric artery, superior mesenteric vessels. So we can see here the superior mesenteric artery. So that is about the relations of the borders. Now coming to the surfaces. Anterior surface, it lies between the anterior and superior borders. It is directed forwards and upwards. It is covered by the peritoneum and related to the lesser sac and the stomach. The anterior surface. Inferior surface, it lies between the anterior and inferior border. It is covered by the peritoneum and it is related to the duodenojejunal flexure, coils of jejunum and left colic flexure. Posterior surface is non-peritoneal. It is between the superior and inferior borders. It related to the abdominal aorta with the origin of superior mesenteric artery, left crus of the diaphragm, left psoas major, sympathetic trunk, left kidney, left renal vessels, the splenic vein. These are the relations of the posterior surface of the body of the pancreas. Coming to the tail of the pancreas, tail is narrow. Left end of the gland, it passes between the two layers of leno-renal ligament with the splenic vessels. Most mobile part of the gland. It is related to the lower part of the spleen, that is the gastric surface. And tail lies at the level of lower border of T12 vertebra. Relations of the tail in front, it is related to, it is separated from stomach by lesser sac. Behind it is related to spleen and splenic vessels. Below it is related to left colic flexure. Peritoneal relations of the tail of the pancreas, it lies in glenorenal ligament along with the splenic artery. What is the clinical importance of this tail of the pancreas? The pancreatic islets of Langerhans are more in the tail of the pancreas. Coming to the duct system of the pancreas. The exocrine pancreas is drained by two ducts. We have main pancreatic duct, which is known as duct of Wilson. Accessory pancreatic duct, which is known as duct of Santorini. Main pancreatic duct of Wilson. It begins in the tail portion of the pancreas by the union of number of small ducts. It passes the left to right through the body of the pancreas midway between superior and inferior margins and close to the posterior surface of the pancreas. In its course, the main duct receives number of smaller ducts that open at regular openings. It resembles the herringbone pattern. Herringbone pattern. At the neck of the pancreas, the main duct passes downwards, backwards, and to the right, reaches the posterior medial wall of the second part of the duodenum. So at the second part of the duodenum, it meets with the bile duct. Both pierce the duodenal wall separately and later unite to form hepatopancreatic ampulla of Vater, V-A-T-E-R. Ampulla of Vater opens into major duodenal papilla. The sphincter of Oddi surrounds the ampulla. You see this herringbone pattern. In the head of the pancreas, it is related to the bile duct portion. Two ducts open into the wall of the second part of the duodenum to join to form hepatopancreatic ampulla of Vater. The accessory pancreatic duct or the duct of Santorini, it begins in the lower part of the head of the pancreas, crosses in front of the main duct. It opens into the duodenum at the minor duodenal papilla, which lies a short distance above and in front of the major duodenal papilla. Blood supply. Head and neck of the pancreas are supplied by anastomosis of superior and inferior pancreatico-duodenal arteries. Head and neck, anastomosis by superior and inferior pancreatico-duodenal arteries to supply head and neck of the pancreas. Body and tail, they are supplied by pancreatic branches of splenic artery. One branch known as the Arteria pancreatica magna accompanies the main pancreatic duct. The Arteria pancreatica magna, it accompanies the main pancreatic duct. Posterior surface pancreas is supplied by dorsal pancreatic branch, which is derived from the splenic artery. Islets of Langerhans are supplied by capillary plexus. Venous drainage. Veins correspond to the arteries and drain into superior mesenteric, splenic, and into the trunk of the portal vein. Nerve supply, sympathetic nerves derived from the celiac and superior mesenteric plexus. Parasympathetic is derived from the vagus nerve. Lymphatic drainage, head neck drain into pancreatico-duodenal lymph nodes. Body and tail drain into pancreatico-splenic lymph nodes. The efferent vessels of the lymph nodes terminate into celiac and superior mesenteric group of pre-aortic lymph nodes. Developmental anomalies. Most common congenital anomaly is pancreatic division. Results in failure of dorsal and ventral ducts. Diffuse detected in 5 to 10% of the population in autopsy studies. Annular pancreas, it is a rare congenital anomaly. Right pancreatic tissue surrounds the duodenum. Pancreatic tissue surrounds the duodenum and may be partial or complete. 1 in every 12,000 to 15,000 live births. So this is pancreatic. We say also the divided pancreas. We say the two birds remain separate. That is pancreatic division or divided pancreas. Ectopic pancreas, described as pancreatic tissue that lacks the anatomic or vascular continuity with the normal pancreas, usually asymptomatic and occurs as incidental findings. Agenesis and hypoplasia. Total agenesis is extremely rare and incompatible with life. Hypoplasia results from absence of ventral or dorsal pancreatic bud. Accessory pancreatic lobe, extremely rare anomaly. Accessory lobe pancreatic tissue originated from main pancreatic gland, may contain aberrant duct. Ansa pancreatica, rare anatomical variation, communication between main pancreatic and accessory pancreatic duct. The predisposing factor in patients with the idiopathic acute pancreatitis, the unknown cause. Thank you very much. So pancreas is very, very important from examination point of view. There is a condition also which is associated with the pancreas, that is pancreatitis. We say inflammation of the pancreas. It is often associated with the collection of fluid in the lesser sac. It's a pseudopancreatic cyst, we say. So with this, we will come to the end of the lecture of the pancreas. Thank you very much.